Hi, I'm Judy.
And I'm Tamara.
Welcome to Balance Not Boring, the wellness podcast that's not about extremes or perfection.
Just real conversations on balancing your mind, body, and soul in our bustling city of Dubai.
So grab your tea and get comfy with us.
Oh, and fair warning, you will learn something. Welcome back to another episode of Balance Not Boring. Today, we're exploring a topic so many people struggle with, but rarely get clear answers on: the rise of allergies, sensitivities, and unexplained reactions, and how they connect to emotional stress, hormones, gut health, and the way we live today. Allergy rates have been increasing around the world, and the UAE is no exception. The dust, construction, humidity, and constant indoor-outdoor exposure, sensitivities are becoming more common. Studies show around 7% of people in the UAE experience allergic rhinitis, and nearly 1 in 3 Dubai children aged 6 to 7 have allergies. With so many new parents here and so many women navigating pregnancy, postpartum, and hormonal changes, important questions come up. Can we reduce the risk of allergies in our children? Are our own sensitivities lifelong, or can they get better? To help us understand this, we're joined by Dr. Shireen Marzouk, consultant pediatrician and allergist at Circle Care Clinic. With a background in behavioral neuroscience, pediatric allergy training in Canada, and clinical research at Sick Kids, she brings a unique and holistic perspective. In this episode, we explore why allergies are increasing in women and children, and what factors truly drive this rise, how hormone stress and emotional load influence the immune system and allergy symptoms, what parents and women can do to understand, manage, and potentially improve allergy and sensitivity reactions. This conversation is practical, research-backed, and especially helpful for women navigating allergies, motherhood, or unexplained symptoms.
Yay. So Dr. Shireen, welcome to the pod.
Thanks
We're
for
so
having
happy
me.
you were able to come. I know how busy you've been, and you were just in Canada, right?
I was.
Tell us about
yeah.
that. How was that?
It was good. It was nice. I mean, it's always nice to be back home, right?
Yeah.
Family, friends, the weather was beautiful fall, but
Yeah.
that lasted for all of 2 days. And then the
that's
rain.
it?
Yeah. 2 days. Yeah. Anyone from
Oh,
Canada will know
gosh.
what I'm
Yes.
referring to.
And then you went to Miami after?
So I went to Orlando for the National Allergy Conference.
Oh, amazing.
It happens every year, and it's in different places in the States. And so it was really nice to sort of reconnect with colleagues and learn a lot more about allergies.
I'm sure, especially from different perspectives and going back to the West and seeing what's new and innovative. That's really cool. So you can bring it back here.
Yeah.
Because as Tamara said, that, you know, allergies are becoming even more prevalent, and it's just something that we felt was so important for adults and to learn about for our children, because it's so uncomfortable to live with allergies and reactions when we don't know like where they're stemming from or what's causing them. So we would love to know how you got into the world of pediatrics and also chose to specialize in allergies specifically.
Yeah. So, I mean, pediatrics for me was kind of a no-brainer when I started medical school. You know, you're working in a fun environment. You know, as fun as medicine can be, but you're working also with a patient population that is extremely resilient. So we know that, you know, kids bounce back, you know, a lot faster and are quite resilient in terms of, you know, diseases that they may get. And so, you know, after doing my pediatrics rotation, I think that was in my 3rd year, I had started volunteering at the hospital. So I grew up in Newfoundland on the east coast of Canada. And I spent a lot of time volunteering at the children's hospital there called the Janeway. And we just used to have such fun activities for the kids, and seeing these children living, you know, with, you know, various types of cancers and chronic diseases. It was just something in me just kind of knew this is where I wanted to be. So that's kind of how I got into pediatrics. So for me, it was sort of, this is why I went into medicine. Allergy, I sort of stumbled upon, you know, throughout my training, and really the immune system intrigued me. The fact that, you know, our immune system is so incredibly sophisticated. We're able to, you know, we're able to manage all these foreign things that our body comes into contact with. And it really just amazed me. And so that's kind of what pulled me into the world of, you know, allergy. And I think the unique thing about allergy that's kind of really kept me going is it's a fast changing area. So, I mean, if you're not keeping up with the research and you're not keeping up with the new treatments, you know, you're falling behind because it's a very exciting area of medicine. We're learning a lot more than we did even 10 years ago. And so for me, I think that that constant learning and new knowledge is just about the immune system is really
Yeah.
kind of what pulled me in.
I mean, just hearing immune system, like I wouldn't have thought the two went together, immune system with allergies. I don't even put that. So it's nice for you to bring that up. And on that note, we'd love to know some definitions of these words because you think allergy, like we all know that means runny nose, that means hives, but there's so much more to it. Same with histamine response, like your allergy, when you have an allergy, what your body might do. So can you explain to us, for those who
Yeah,
don't know,
absolutely.
us commoners in this world
Yeah.
of allergies?
So, I mean, an allergy or an allergic response is basically your body trying to fight off something that is foreign. Okay. And it's part of an immune response that sometimes you develop over time. Some kids, you know, it could be to a lot of things. So, you know, the most common ones that people know. So foods, you know, can be a trigger. Also, environmental factors, so things like pollen, etc. Your body perceives them as foreign. And what it starts to do, it starts to create an immune response, a very specific immune response. So what does that mean? That means your immune system is almost like a bunch of soldiers that you have. There's different levels of soldiers. There's what we call our first line of defense, which is basically our skin, you know, chemicals that, you know, that sort of attack anything foreign coming in. And once it goes past that, it goes to something called our second line of defense, which is a little bit more complex. So, so that's basically the immune system in a nutshell. And really, allergies are perceiving something that's foreign when it isn't, and so attacking it when it isn't. And so what happens when we have, you know, you bring up histamine. And so when we have an allergic response, it all really comes down to cells called mast cells. And these mast cells, if you think of them, they're almost like small balloons. And these balloons have very active chemicals in them. One of those chemicals is histamine. There's a lot of other different chemicals. These mast cells are kind of like tiny balloons that line the skin, line your digestive tract, line your respiratory tract. They're basically found anywhere. And then once you're exposed to that trigger, whether it's a food or it's an environmental, you know, factor, you have firing of these mast cells. So almost like these balloons burst and you have the histamine being released, you know, into the blood. So the mast cells that are on the skin that burst, you get hives or you get itchy skin. The ones that can be in the GI tract, you get a lot of, you know, people can experience some stomach cramping, some abdominal pain, sometimes some vomiting. In the respiratory tract, in your lungs, when these burst, they can cause shortness of breath. They can cause coughing. They can cause chest tightness. And so these little balloons are found everywhere in your body. And everyone is a little bit different in how their body responds to these triggers.
Can you list like the most common reactions you see versus the more rare?
Yeah. So, you know, in pediatrics, I have to say, you know, food is, you know, one of the common reactions that we do see. Typically, these children may come to my clinic with a history of vomiting after eating a food, sometimes hives, which are, you know, patches that appear on the skin that can be a little bit itchy, sometimes coughing after a food. The common foods that can do this are, you know, really any food can do this, I should say, but there are common allergens. A lot of what I see here in the Middle East is actually sesame. So this is something that I didn't see much of back home. Peanut, I know everyone knows peanut, is the most common one. And then tree nuts, so things like cashews, pistachios, walnuts, pecans, hazelnut, dairy, milk. That's a very common one. Actually, milk and eggs. These are the two more common one that we see, in infancy, and some kids can outgrow them. So food is a common trigger. I would say the other kind of group of triggers that's very common are the environmental triggers. So dust mites, I would say, are probably the most common one that I do see here in the Middle East. Back home, it was more so grass and tree pollen. So it really depends where you are, but the triggers, do kind of elicit a very similar response. And so it's really important to see someone that's a specialist that's able to kind of give you answers as to why, your body is having these symptoms.
When would it be an appropriate time to come and see an allergist? Is it the first time you see a symptom? Is it the 10th time? When is the appropriate time frame?
It's a good question. And I would say that, so as a mom, I'll give you perspective as a mom, I would want answers after the first time something unusual happens. As a doctor, I'm also going to say, if you see something that's unusual, always take pictures. Pictures are very, very helpful. So when a family comes in and they say, this happened to like my child, and I'm like, do you have a picture? It's the first question I always ask, because pictures speak 1,000 words. And so when I'm able to see that picture, I'm able to really tell what happened, and also with the story. And so to answer your question, I would say if something happens that's out of the ordinary for your child, especially if it's with food, I would say go see your doctor.
What's a normal histamine response versus one that would elicit a lot of concern and immediately to the hospital?
So we all have histamine. Histamine is a very normal part of our immune system. And again, histamine is only one of the triggers when it comes to allergic reactions. So it's not like we can't really blame it all on histamine, but we can blame a lot of it on histamine, because sometimes we do take the antihistamine,
Yes.
right? And that's where that comes into play. So an abnormal response would be, if your child, for example, is having symptoms that are persistent when they are, for example, being exposed to something. So say you have a dog at home or you have a cat at home, and this doesn't have to be a child. So say, I do see some adults as well that come in with their kids and they're sniffling, and they've had sort of these ongoing symptoms. And really an abnormal histamine response is, it can vary from patient to patient. So that's why, it could be the hives. It could be the runny nose. It could be the congestion. It could be the persistent coughing. It could be the flushing. It could be the lip, tongue swelling. So, there's a lot of different things that can come out of what we call an allergic response. And it doesn't look the same in everyone. And that's why, I always say, if there's something that seems off, always go and speak to a specialist and speak to someone where this is kind of their expertise to get more answers.
This sounds, when you're listing those reactions and symptoms, it sounds a lot like what a cold could be. So how can someone right off the bat, if they're at home, they're like, I can't tell if I'm sick or if it's an allergy, even if they don't know they have them, but they just don't know what's going on. What's something like you can just tell us quickly, this is a cold versus an allergy?
So I would have to say the classical thing when someone comes in and they're sitting in front of me and I say, I ask one simple question: how long has this been going on? When they say a couple of days, okay, my mind starts to shift a little bit. Oh, it happens every day. It's been going on for years. And then, so the one thing that can differentiate cold symptoms versus allergic symptoms, because you are right, they both do have some similar symptoms in terms of nasal congestion, stuffy nose, sometimes itchy eyes, coughing, etc. Duration, right? So how long has this been going on? So if this has been going on months and months, not just weeks or not just, days, then, that should alert something. That being said, I do also see a lot of kids that are in daycare, they're in nursery, and a lot of moms are trying to figure out, they always have a runny nose, like what's going on? But then when you really kind of get past how long they've had it and you ask, okay, when are their symptoms sort of the worst? It's always, in the morning they wake up and it's just, they have this constant cough or constant, blocked nose in the morning. And so sometimes too, the timing of the symptoms is very helpful. Oh yeah, they always have this, when we're away in, the UK or when we're, in very grassy areas. So the other thing is the timing of the symptoms. And then I think the biggest thing is, resolution of those symptoms. So meaning that, yep, they, those symptoms went away for a couple of weeks and now they're sort of back. And so in a lot of cold symptoms, although they can look the same, these symptoms usually peak within 3 to 4 days. And then they sort of get less. So I draw the classic graph for my parents when they come in and I'm positive they have allergies and, and sometimes we do the testing and I'm like, listen, it's all negative, but your child who is in daycare or nursery, they're getting back to back to back to back infections. And you can develop something called non-allergic rhinitis, which is a allergic cause of inflammation in the nose. And in a lot of these preschool children, we see it because they get constant viruses. And I draw the classic graph, which basically peaks at, 3 to 4 days, and then symptoms sort of may get a little bit better. Yes, they may get another viral infection after this. So it's very important to kind of pay attention to the duration, the timing, whether or not you're seeing these symptoms with specific things and specific, maybe pets that your child's being exposed to, specific places. So all of these are kind of pieces of the puzzle that we put together.
Is it true or false? Because I've heard this, that if you expose your child earlier on to pets or like just other environments, that they're more likely to develop a stronger immune system?
So that's an excellent question. And yes, there's a lot of research around that. So there is actually a study that came out last year to show that kids that actually grow up around dogs sometimes have a lower incidence of allergies, which was really interesting. And they did link it back to something, to do with the saliva of the dogs, et cetera. But the other area of research that has been done around this is, you guys have probably all heard the hygiene hypothesis, how, nowadays we're too clean. And so there's a lot of interesting research being done by a group in Germany. And they just published a study that actually compared kids that live in urban areas versus kids that live on farms. And these kids had, similar genetics, similar background. And they found that the kids that lived on the farm had a significantly lower incidence of allergies, of asthma, and all the allergic diseases. And we think it has something to do with actually being exposed to, animals plus cow sheds. So sheds where, the cows are kept. We know that sometimes there's some early exposure to dust mite there. So definitely your environment does play a role. And then, just kind of backpacking on your question of early exposure, there is now, evidence to show that early food introduction can help prevent kids from developing allergies.
Which was not the case 20, 30 years ago.
Right?
My mom was like, you're giving peanuts to your daughter? Like, you can't do that.
Yeah.
She's going to get allergic. I'm like, no, they say the opposite.
Yeah.
So what is that? What's the rule of thumb?
Yeah. So this is actually based off of the LEAP study, which was a study done in the UK. Now it's been out for 10 years. And what they did was they gave kids, from similar families, similar genetics, they gave half of them peanuts very early, early being 4 to 6 months of age. And these kids had some risk factors. So we know there's risk factors for developing allergies. So if you have, eczema, if there's a family history of allergies in the family. And so they gave half of them peanuts very early, 4 to 6 months. And what they found was that when these kids grew up, they had an 80% less risk of developing food allergies. And so it all links to the microbiome of the gut. So what is the gut doing within, those first couple of years of life? And we now know that early exposure, so this study's been out for 10 years now. And so this is why it goes back to, it's a fast evolving field. So if you're not kind of keeping up with the field and you're still 10 years ago saying, no, wait, don't introduce that egg, or, don't give them that dairy, or don't introduce the peanut until, we now know that that's wrong advice. We should be giving our kids everything early. Obviously with nuts, we have to be safe. It has to be, ground. I always tell parents, like, grind it really fine and sprinkle it in their oatmeal or sprinkle it in some sort of food that they're eating. But we now know that early exposure and persistent exposure, so it's not like introduce the peanut or introduce the sesame and completely forget about it for the next couple months. Early and consistent introduction can help prevent kids from developing food allergies.
That's cool to know. And how about for women versus men? Obviously, like, we care for, we are kids, we grow up, we have allergies stick with us, or maybe we develop allergies later than in life. So how do you see allergies manifest in women versus men differently? Could it be related to hormones or anything, or do you see it similar?
So it's an excellent question. And it's a well-known fact that we know hormones play a huge role when it comes to allergies. So hormones can be what we call a trigger. So there's, various different triggers. And some patients will tell you, after pregnancy, I developed this allergy. Or, after pregnancy, I developed this, or after pregnancy, this went away. Or and I see it also in the adolescent age group that are going through puberty, right? And so I've never had this before. And all of a sudden, I've developed hives that are coming out of nowhere around the time of the month for me, right? And so it's a well-known fact that hormones play a huge role. And I think as women, and especially as mothers, we can be very dismissive of our own symptoms. And I'm not going to tell you how many times, the mom brings in the child to me and she's there standing in the corner, sniffling, wiping her nose. And it's happened so many times. The classic thing is, do you have any allergies? When I'm asking, the story of how everyone else is at home. No one with allergies, and they're sitting there like sniffling, grabbing the tissue box. And I'm like, okay. And then, I had one parent in particular that a couple of months ago said, no, I've been living with this my whole life. She has 4 kids, super busy, from practice to dance class for this and she doesn't have time to stop and think like, is this something that maybe, I need to address, and for me, when I sort of delved into it, and she says, yeah, sometimes, I have sleepless nights because of it. I'm up, sneezing, I'm up coughing in the middle of the night. I have to use a box of tissues. And so I think, as women, we need to be very cognizant, especially times of change in our life, whether that's puberty, whether that's teens. We need to teach these these growing adults how to be in tune with their body and how to, really learn to listen if something is not right. And as moms, not forget ourselves.
Of course.
Right?
So for the working mom, like you were talking about your patient, no time to look after herself, focus on the kids. What are some signs, other than a sniffly nose, for example, if you can walk us through some signs that might raise a red flag to possibly, get checked? Because we all suffer from runny noses and we just dismiss it.
Yeah.
But a runny nose for a couple of days is different than a runny nose for months.
Yeah. So I have to say, the majority of, patients that I've seen who've had parents coming in with, these lingering symptoms, a lot of them are what we call, especially with the environmental allergies, a lot of them are allergic rhinitis symptoms, which are really a lot of nasal symptoms. So blocked nose, runny nose, itchy eyes, okay? any sort of swelling or itchy rashes that can develop on the skin that may sometimes come and go. These are kind of the classic symptoms I see. And for that working parent, it's how long have these symptoms been going on? Because if they've been going on for, weeks or months, you need to get it checked out, because as much as it may be very just a blocked nose or whatever, this can interfere with your breathing. It can interfere with your sleep. It can interfere. And ultimately, if it's interfering with breathing and sleep, it can interfere with your quality of life, right? And so a lot of people are very dismissive because sometimes the symptoms may be, not severe enough that, I have to run to the emergency department, but they can catch up to you.
And they can progress or get worse over time.
So some can, and some kind of just stay the same, right? And I've definitely seen some pregnant moms from, bringing one child to bringing in the next, their symptoms have sort of gone. But I think the matter of the fact is you need to figure out what's causing the symptoms, so what is the root cause? What is causing these?
So there could be another side of a cause that not everyone would think about, which is the emotional side. So the mind-body connection. Do you think emotions or stress, burnout, cortisol, anxiety, all of that, can that play a role in allergy reactions?
Yeah. So, stress, we know that, people, I've seen people develop what we call stress-induced urticaria. So that's hives because of stress. So things like stress, hormonal changes, we do know that, yes, these can be a trigger, right? And so, I've had patients who, I had this teen who was having hives every Tuesday and Thursday. And, initially she was, bouncing back from doctor to doctor. Yes, it's, when I eat this, it's because I eat this on these days. When she came to me, I said, I don't really think this is a food. Like, this has been going on for a while, and you eat these foods on the other days too. So what's going on Tuesdays and Thursdays? And we actually, figured out that it actually had to do with a specific class that, she was taking in university. And this was extremely stressful for her. And this sort of precipitated or, kind of brought out that reaction. So can stress play a role? Absolutely. It can. And I think, as women, we have so much going on, in our life, whether it's work, whether it's, kids, and we're trying to multitask this. And we really do sort of forget ourselves in the middle of it. So stress can definitely play a role. And I think that it's very important also to develop those coping mechanisms. And everyone's different, and everyone's coping mechanisms are a little bit different. It's really important that as we get into kind of the more responsibility, et cetera, that we actually teach kids how to deal with stress, because that's something that we carry on for the rest of our life, right? And it can affect not only, allergic diseases, or it rolls into a lot of different areas of your life.
How does allergy medication come into play, like histamine medication? Is it safe long term? Is it just a Band-Aid? Talk us through it.
Yeah. So histamine, again, most of the allergy medications, there are a lot more treatments now besides antihistamines. So when you take something like an antihistamine, and it could be, anything like Zyrtec or, Claritin, loratadine, all of these medications are an antihistamine, which is really, yes, it is a Band-Aid solution. Because if you think of those balloons that we talked about initially that are bursting, what that actually does is it just binds onto the histamine and doesn't let it create that reaction that was going to create on the skin or, in your digestive tract, et cetera. So are antihistamines safe to use long-term? Some are, some aren't. Okay. So when we talk about antihistamines, there are two sort of classes of medication. So there's what we call the first generation, which are the older antihistamines. So things like Fenistil, Benadryl, Piriton, these are not safe long-term. We know that these older medication, they cross the blood-brain barrier, meaning that they get into the blood and they can actually have some neurological effects, meaning that they can make you sleepy. They can make you, kind of confused, drowsy. And I tell all parents, like, no one should be on these medications, especially when you're having an allergic reaction. We don't want you to be sleepy. Like, I need to assess, I need to, properly assess you. So long-term use of some of these first-line medications like Benadryl actually show that there is a link to memory issues, sort of later in life. Not for all patients, but definitely there are some studies to show that these are not safe to use, neither in the short term, neither in the long term. And they can actually cause, some unwanted side effects like urinary retention, meaning that, you're not able to kind of pass urine, dried lips, dried mouth. And so these are not kind of safe medications to use long-term. However, the second generation medications, which are the newer ones, yes, these are safe to use, but it all goes back to, you need to know what's causing the issue, right? Like, you can't keep putting a Band-Aid onto a solution. Like, it's perfectly okay if you say, listen, I have, a dust allergy, I get a blocked nose. I don't think I want to do, we can now desensitize people to these things. So we give them a natural form of dust that we're able to sort of get the body used to tolerating it again in a very safe form. But it's a commitment. And a lot of people, may not want to commit to that. So as long as you know what's causing it, this is the main thing when it comes to allergies.
So is there a safer, more root-caused approach? Like, let's say somebody's anti-medication, they just want something more natural. So are there other supplements that you would ever recommend to your patients?
Yeah, so I mean, not so much supplements, but there are ways that we can safely, what we call desensitize, which is basically get the body used to tolerating the allergen again. And, things like environmental triggers, so grass pollen, tree pollen, house dust mites, even cat and dog dander. We know that there are safe ways to do it by using, immunotherapy is a very fancy word, but it's really just taking the natural form of whatever you're allergic to in a very, very small amount. Comes in different forms. We use the one that goes under the tongue. There's sprays. There's also, if you ever hear of people getting their allergy shots once a month. So these are natural forms of the pollen that we're giving the body in very, very small amounts over time. And this is sort of, a new area for food called oral immunotherapy. It sounds like a very fancy word, but it's really just microdosing food in a very safe way to help increase the tolerance of the body to these foods.
Under guidance, obviously.
It has to be under medical guidance.
Okay.
Yeah.
So on this note with kids, do you think, just in general, when you see all of your cases, would you say that a lot of this is started in the womb, or would you say it's mainly environmental?
It's a very great question. It's a mix of both. Okay. And so when we talk about nature versus nurture, when it comes to allergies, there is absolutely a genetic role that is played, but the environment plays a huge role as well. And so, there are things that we know we can do very early on. Definitely having the mom eat a wide variety of foods. Sometimes we know that, there's exposure through the placenta, things like breast milk, we know, definitely contains, immunoglobulins that, can all really sort of alter the gut microbiome. But even beyond that, the environment, when that child is born, we know that, for example, going back to early introduction of foods, we know that completely changes the microbiome. And if someone has a high risk, meaning that, they have everyone in their families has allergies and, they have eczema when they're really, really young. We know that early introduction of foods can help reduce the risk of developing allergies because it exposes the gut to all of these, great natural things that help really develop a strong microbiome. And it's not 100%, and you can never guarantee anything in life 100%, but we know that's the best tool that we have, especially when someone is at higher risk for developing allergies.
So there's also the age-old question, does the way a baby is born, vaginal birth versus C-section, affect their microbiome and their ability to develop their immunity?
Yeah, so it's a good question. I mean, there are a lot of studies to suggest that, the microbiome of a C-section baby is a little bit different from one that's born through vaginal delivery. But your second part of your question, does that, dictate, is that child going to develop an allergy just because of different microbiome? No, there's so many different factors, right? So if you are to take, someone that has had, say a very restricted diet, during pregnancy, had a vaginal birth, has very high risk of allergies and, didn't introduce foods early on, we know that that's now the biggest kind of thing we have in our back pocket to tell people, introduce the foods early. It's not that we don't care what happened before that, but allergies are very complex. So it's not just a box that we're taking. Yes, this was a natural birth. Yes, this was a C-section. There's so many other things that affect the microbiome. Antibiotic use early in life. We know that that is a huge risk factor, right? For kids, for just altering the microbiome early. And that can be another contributing factor. So all in all, there's so many things that contribute to developing allergies. And it's not just that one thing that we should be fixated on. We should be fixated on how can we prevent rather than the things that we can't control.
What about probiotics? So is it worth giving a child probiotics at such an early age to prevent allergies potentially, or to build a stronger immune system?
So it's a good question. I mean, the research is still being done on, a child who's taking probiotics. Do we know that, they're less likely to develop allergies versus a child that's not? The evidence isn't strong enough to say, everyone needs to be on this because it helps to prevent, allergies in everyone. So probiotics generally do, play a role, especially when it comes to children that may be, experiencing colic. There's a lot of research around that. Or children that may have other digestive issues. But when it comes to allergies alone, we know that the diet plays a bigger role. So for me, when patients come to me and they say, what should I be doing for my, infant when they're coming, with their toddler? And I say, you need to give them everything, yogurt, sourdough bread, things that do contain natural probiotics, but also healthy foods.
So also within I guess when you're pregnant, I mean, the reason I'm asking this is a lot of us wonder while we're pregnant, what we do might affect our fetus, whether what we eat affects their allergy response or how stressed we are. Does the baby feel it as well? So from your experience, can maternal stress during pregnancy, just everyday stresses that we go through, or chronic stress, can that cause maybe an onset of eczema or allergy reactions for the baby later on? Is it more common with kids that you see that have eczema or these allergies? Is it more common that you see the mom has had a stressful pregnancy? Is where I'm getting at.
Yeah, it's a very good question. So again, stress plays a big role, more so in the health of the mom, which obviously has implications on the baby. So is a mom that's more stressed, is her child more likely to develop eczema? That what you have to think about is kind of the domino effect. That really stressed mom, is she going to go into preterm labor? Is she going to deliver early? Is she going to, and we know that, the child that's born a little bit early, everything is a little bit, underdeveloped. And so, is that gut going to kind of, get the exposure that it needs to in utero? So No, there's no direct link, but I think there's a little bit of a domino effect. That's why it's really important for pregnant moms to take care of themselves, Eat, eat everything when you're pregnant. We again, studies do suggest that when you have, a varied diet that includes allergens, this can be helpful for the baby when they're born. But, I don't think we can say that stress, stress in your 20th week of pregnancy is, linked to a higher rate of eczema, but certainly, it can lead to other things throughout the pregnancy that may, put that child at risk for developing, other early sort of chronic diseases.
In terms of the mom eating a varied diet when the mom's pregnant and the baby's born, what is the best practice to introduce allergens? If the mom had eaten allergens throughout her pregnancy, it doesn't necessarily mean that the kid is immune automatically.
Yeah.
So how would you introduce that? And what's the best way to go about it, especially if we're talking introducing allergens early on?
Yeah, 100%. So this is basically what I preach every day. So number one is timing. So early, going back to when we should do it in that infant, early introduction, right? So 4 to 6 months of age, get your pediatrician's, approval before you do that. Obviously, you need to have good head control. The child needs to have a good sort of suck and swallowing coordination. And so I always say, get your child assessed first, kind of get the go ahead. Number two, how do you introduce them? So there's 2 ways that you can introduce things like peanuts and tree nuts. The one way to do it is to absolutely just crush everything into a fine powder. And I tell parents, crush it, as finely as you can, and you're going to sprinkle it in, that oatmeal or, the porridge that you make for them. And once you introduce it, the amount, so when you're introducing allergens, they don't need to sit down and, chow down on a peanut butter sandwich or eat a whole egg, or the gut needs to be exposed to a tiny bit of it. Okay. And, the problem with some of the allergens too, which doesn't help, things like peanut butter, the consistency, eggs, they're a little bit slimy. So the instructions that I tell parents is you're going to take a very small amount of that, finely ground peanut, finely ground cashew, finely ground pistachio, whatever that allergen is, or even eggs, cook the egg really well, the white and the yolk together. You're going to take a very small amount and mash it into the oatmeal that they're eating, into something that they're eating every day. And that, this is sort of their normal. So number one is timing. Number two is consistency, right? And so, the importance of allergen introduction is sort of lost if you're not consistent. And we know that that number is somewhere around, making sure we get the foods in about 3 times a week. And so I know this can be super stressful for parents who are new moms, and, there's a lot to do. And so that's why I always say, come up with a plan, with your doctor as to what is the best way to do it in my child. Some kids also taking the peanut butter and, diluting it using some water just because it's really sticky. And, sticking it in the oatmeal or something else that they're eating, and you only need a very small amount, something like even 1/4 of a teaspoon, just to kind of mix it in. But again, that consistent exposure is very important. And the ones that you really want to focus on are eggs and doing the white and the yolk together. The white is the more allergenic portion. However, you always want to introduce both together. Peanuts, and then the tree nuts that we talked about, sesame, things like fish, shellfish. And just to go back to your first question, what types of food you want to do it in the most natural form as possible. So, make sure it's not, seasoned, not battered, not, in the most natural form possible. And you're going to mix it into something they're already eating.
And is it 1 allergen per meal?
That's a good question. So a long time ago, we used to say, wait 3 days, one allergen every 3 days. We now know that if you're going to have an allergic reaction, it's, a true immediate allergic reaction, or what we call IgE mediated, which are the ones that we worry about, hives, etc., happen, typically within 1 hour, but we say up to 2 hours. I always say to parents, number one, introduce it when you are able to monitor them, not someone else. You're able to monitor them for at least an hour or so. Don't give them the food and then put them down to nap. And number two, you can do one allergen if you want, every day or every other day. So there's no hard and fast rule, but as long as you're there to monitor them for that period, that's the most important thing.
So what happens, God forbid, during these experiences where there is a big reaction, severe reaction, and you don't have time as a parent to rush your kid to the hospital, there's traffic, something's going on.
Yeah.
Should we carry an EpiPen at home all the time, just in case?
The answer is no to that. Not everyone should have an EpiPen. EpiPen should be reserved for people that have allergies, for patients that have experienced some form of anaphylaxis in the past, which is kind of a severe form of allergy that you can have to other things besides food. If there is a child in the family that has allergies and you're introducing allergens to their younger sibling, you can always have something like an antihistamine at home, which is, very easily available. The risk of developing a severe allergic reaction, something like anaphylaxis, is uncommon in less than, 1 year of age. It's not something that is commonly, it is rare. And so generally, if you're doing a very small amount, if you have an antihistamine on hand at home,
that should be fine in most cases.
Yeah, not everyone needs an EpiPen.
I have this fear, like, God forbid, of being stung by a bee and not knowing I have an allergy, or my kid, for example. Mm-hmm. That's when I'm like, what do we do in this kind of like severe case? Like, I guess we rush to the hospital, right? Because you can give them the antihistamine, but maybe it's not enough in those severe cases, right? Like, you still should go to the hospital.
Yeah. So, a lot of these severe reactions, and this is unfortunately what makes it to the news, right? And these instances are very rare, right? So, antihistamines for, a mild reaction generally will kind of do the trick. And most of the times, I would say if you are having a severe allergic reaction, definitely do seek, medical help. And I would say call an ambulance, because the ambulances are, stocked with Epi. We know EpiPens, and they know how to use them, rather than, taking your time and maybe trying to get to a hospital nearby, etc. So call an ambulance.
Okay. How do you use an EpiPen?
Well, luckily.
So I actually brought...
I see one here.
Yeah. So there are various types of EpiPens. This one is the most common one in the UAE, and it is actually called epinephrine. And what's inside of here is the medication, adrenaline or epinephrine. And it's basically a life-saving medication for patients that have severe allergies. And the way that you use it is pretty easy. Blue to the sky, orange to the thigh. And so this blue cap comes off, and the orange part goes into the meaty part of the thigh, so the side of your thigh. And you want to press down until you hear that click, and you hold it for 3 seconds. So 3, 2, 1. And everyone with an EpiPen should always have 2 EpiPens, because we know that sometimes one EpiPen sometimes may not be enough, or sometimes we can have something called, a biphasic reaction, which is kind of a number 2 reaction that happens after a little while, when you first treat it. And so I always tell patients that, seek medical attention, go to the emergency department. And if you feel like you need to use that second EpiPen before, you should use it.
That's really beneficial to know.
Very.
So to end on more of a calmer, positive note, we'd love to know the woman behind the coat. You're not wearing your coat today, but I've seen you in your white coat. So first, we want to understand the misunderstanding. So what's the biggest misconceptions women have about allergies or their immune system?
I think the biggest misconception is that the symptoms are not an allergy and they're just going to go away. I think just not knowing is probably the biggest thing that I see is the not knowing. The misconception also, especially if it's, an allergy that can be, very mild, especially if it's to food, etc., that, this is going to go away. I don't need anything. And they learn to live with it.
So knowing you have allergies, let's say you've done the testings, how do you learn to live in peace in your own skin, knowing you have these irritations, these reactions, in a way that's sustainable? Because sometimes we're living in a dusty, polluted city and we deal with itchy skin on the daily. So what would be your advice just from a mental health perspective for us that have to live with it?
So I think, number one, knowing what you have is probably the most important piece, because if you know what you have, there are so many treatment options. 10 years ago, we would say, okay, here's your EpiPen, see you later, see you back in, a year, we'll retest you again. Or, if it was some sort of dust allergy, okay, here you go, here's some nasal spray, antihistamines, some Band-Aids on the solution, and know that there are treatment options. And, what I tell parents is, and patients, like, if you are not, given multiple treatment options, then maybe it's useful to get, another opinion, talk to someone else. So yes, I think you have to learn to live with it and learn to cope with it, but your quality of life also doesn't have to be horrible. Right? So yes, you have to learn to live with it, but also you have to know there are treatment options. So there are treatment options for all of these things. So I think knowing how to seek them is probably the key.
If you had to choose one daily habit that would genuinely improve their immunity and allergy health, what would it be?
If I had to pick one, it would be master the basics. Eating, sleeping, and moving. Yeah. Eating healthy, making sure you're getting that sleep. And moving. That is the real key to good immunity. A lot of people think it's, the supplements that you're going to buy off the shelf, that longevity, IV drip. I'm seeing a lot of these, and really, if you are not eating the right foods, if your iron is low, your vitamin D is low, you're not sleeping well, your immunity is never going to be 100%. You can do the IV drips until, the cows come home. But,
yeah.
That is really what it comes down to. And once you've sort of mastered the basics, then building on that foundation, because without that foundation, nothing matters.
Can I ask you quickly, for my kids, I religiously try to give them iron, C, and D, thinking those are the immunity boosting vitamins. Am I right?
So,
like, no.
So the only one that we know 100% links to immunity is vitamin D. There's no great research around this. Why are we not giving them, why are we not enriching their diet with like good iron-rich foods, good, fiber, good, sources of magnesium, calcium, these are all very important things. But if the child has a well-balanced and healthy diet, we shouldn't really need to supplement anything else other than vitamin D.
Unless they're picky or have a stomach issue.
Yeah, I mean, these are the exceptions, right? Picky, I have a lot of, kids, for example, food allergies that have food allergies that can't eat certain foods, right? Milk is a big one,
or
like
eggs.
Calcium. But there are so many other ways we can kind of get that calcium into the diet. And so I know people get fixated on the multivitamin that my child should have. Realistically, the only multivitamin your child should have is good, nutritious food.
That's a good one. And on that note, this conversation was amazing and very, very beneficial. So thank you, Dr. Shireen, for breaking down allergies in a way that makes sense for both parents and anyone navigating their own health. You can follow Dr. Shireen on @Dr. Shireen Marzouk. Any other place that people can follow you on?
I'm at Circle Care Clinic, so people are more than welcome to, follow me. We do some educational content. And then we do post also some of the research that we've been doing, in Toronto at the Hospital for Sick Children about oral immunotherapy, which is increasing or desensitizing kids with different allergies. And so I post some of those. We just have a recent research article that was published last month. And so I post some of these articles, and
That's
yeah.
amazing.
It's amazing.
Congratulations.
Thank
That's a big
you.
deal.
That is a
Thank you.
very,
In the
very big
medical
deal.
world, wow.
If you're listening and want to go deeper, DM us the word allergy and we'll send you a cheat sheet plus a recommended testing list for adults and for kids. Share this episode with a friend, especially a parent who might be brushing off symptoms in themselves or their child. You never know who needs this information. Make sure to follow Circle Care Clinic to stay updated on pediatric allergy care, family health, and all incredible work their team is doing. Thank you for listening, and we'll see you in the next episode.
Thank you.
Thank
So good
you.
to have
Thanks
you.
for having me.